Hi, I'm Dr. Nathan. I'm a Maxillo Facial Surgeon and I head the Department of Maxillo Facial Surgery in Apollo Specialty Hospital, Perangudi OMR. And we basically deal with all the facial bones. Face is the most important part of the human body today. We are identified by our face, and all the functions basically, like seeing somebody, the function of the eye has to be proper because it has to be situated in a proper socket, and the cheekbones has to be proper so that we get a proper width of the face. It allows the lower jaw to open and close. It gives sufficient space. So the upper and lower jaw has to function normally because we can chew food, we can talk to people. So all these functions, speaking, chewing, looking at somebody, everything, based on the facial bones architecture and functioning normally. So in maxillofacial surgery, we deal with the problems associated with the facial bone. Sometimes it could be genetic. By birth wise they might have some deformities. Sometimes it could be acquired. Sometimes children, they grow, they do some habits like thumb sucking and all that, where the upper jaw and lower jaw grows in different directions with deformity. We do correct that also. But sometimes, unfortunately, with a simple accident, a normal person can get completely injured, and who was functioning normally can get completely handicapped. So as a maxillofacial surgeon, our aim is, in a patient which undergoes a complete facial fracture or facial trauma, we make sure the patient gets all his functions back to normal. So here I have a patient with you, Mr. Faheem. He's one of my patients whom I operated about 6 months back. And tell me what happened to you, Faheem.
Yeah, so hi. I met with an accident on 25th of September. I was hit by a biker on OMR Food Street. So what happened was I was hit by him on my left side while I was crossing the road, and I was brought to the ground, and I also broke my face. I had so many fractures on my face. My lung was punctured along with my ribs fractured. So these are all the things that I had, and I also had my a part of my flesh from my shoulder removed, like it got scraped off. So this part of the flesh was open wounded, and everything else was there were minor wounds everywhere. So after that, what happened was I was brought to the ground, and the people there, the by passengers, they called an ambulance. It came like within 2 minutes, and then I was taken to the hospital. I was unconscious mostly, like even in the ambulance. Like I was firstly I could see some people, and then my right eye was kind of blurry. So it was. I was opening my eyes sometimes and then it was closing, so I didn't remember much. But then when I was brought to the hospital, I was asked some certain questions, to keep me awake and all. And then after that, I don't remember anything.
Yeah, he was basically brought to the emergency. Now he is a patient with a complete, very severe injury, like his complete facial bones, all the facial bone, eye bone, cheek bone, upper jaw, lower jaw, his both the joints, everything is fractured. We call it as a pan facial fracture. And also not that he had a rib fracture, he had his left hand fractured, and he had lost a lot of tissues from the shoulder. So basically when he came to the emergency, he had a compromise even to breathe. So our emergency department did an excellent job by intubating, putting him a tube to retrieve his airway. And it is a team of doctors, the orthopedic surgeons, Dr. Nandakumar Sundaram and team. He had a mild head injury also, which is by Dr. Anil Pandey and team, and the plastic team, Dr. Kamakshi and team, and my team, the maxillofacial. So it's a very team approach of, because he had to be represented for his facial injuries, his chest injuries, rib fracture, hand fracture, shoulder tissue gone. So as a team, we operated together on the next day because we saved the time of anesthesia. So when I'm operating on the face, Dr. Nandakumar Sundaram was operating on the hand. So it's a teamwork which we did the job. So from my side, I have fixed him everything. His eye bones I have fixed. Close your eye. See, the scar is here. The scar is here. The plate is inside. But when he opens his eye, you can't see the scar. So both the orbital bone is fixed through that, and his cheekbones are fixed with plates. His upper jaw is fixed. His lower jaw is also fixed, and his joint is also fixed through a small incision behind the ear. which the patient can't see. So today you look at him, his face, there is no scars at all, but he's got multiple titanium plates in his face, and he can see normally. He's a system, what do you work as?
Yeah, a programmer analyst.
Programmer. He can see his screen properly without any problem, and he can open his mouth and he's closed his mouth. His facial height is restored. His facial, the width is restored, and complete balanced face, just like how he looked before, and all his functions also is completely normal. How do you feel after the treatment now?
Yeah, like initially everybody was afraid for my life. That was the main thing. Like I didn't, obviously people were not, like they couldn't believe like I was alive even after my life was saved. And after that, it's not just that, it's not just being alive, it's coming back to life. That was the most important thing. I can walk, I can talk, I can eat whatever I want, I can chew properly, thanks to all the facial surgeon and everything. And like I feel okay, I feel completely fine thanks to all, not just the doctors, the nurses, the staff, everyone was so kind and everything. So that's one thing that's really important in the medication of a person, to have a healthy mind, to make sure that the patient has a healthy mind. And after that, now I don't even feel like I was in such a terrible accident after all. I feel like it was just a bad dream or something.
See, that's exactly what we want to know. Like, accident is an unfortunate thing. Any handicap or any deformity can carry towards the rest of your life. We want to make them so normal that they don't remember this as they like how he said, as a bad dream, and they just want to forget it and have a good, happy, healthy life. That's what we are aiming at. Thank you.